Let's take stock of what's happening with the COVID situation here closer home in Mumbai as well as Maharashtra. And this after Delhi issuing a yellow alert in the city just yesterday. We have with us Dr. Rahul Pandit, Director Critical Care Fortis Hospitals in Mumbai and member National COVID-19 Taskforce and Maharashtra's COVID-19 Taskforce as well. And also with us Dr. Shashank Joshi, Maharashtra COVID-19 Taskforce member and Dean at Indian College of Physicians and Consultants at the Lilavati Hospital joining in. Doctors, thank you so much for taking the time out and speaking with us. Dr. Pandit, if I could begin the discussion with you really, what is the situation on ground? Because, you know, there is once again a lot of panic like we saw in the first wave and the second wave. Sure enough, even around us, the numbers have seemed to have increased. But what really is the situation right now? Are we at the panic stage? Are we close to, say, suppose Delhi of issuing a yellow alert in the state of Maharashtra as well?
Good morning. So I first of all, I'd like to assure that let's not panic. I think we've known the virus for 2 years. There's still a lot of unknown there, but we should not panic. We should probably go in a right methodical way, which is what we are doing right now. So certainly the numbers have increased in the metropolis cities, Mumbai, Delhi, Pune. However, there is no increase in the hospitalization as of now or severe disease. Having said that, I must put up a word of caution that we generally don't see any hospitalizations in the first week or 10 days. They almost start towards the end of the second week and sort of go up in the third week or so. The second concern which all of us have is this rise in the number driven by Omicron, or is it a combination of Delta plus Omicron? As of now, it looks like it's probably a combination of Delta plus Omicron. But we need to await the genome sequencing reports to understand how much of Omicron is actually contributing to this rise. Because if Omicron is contributing to this rise, we can expect a similar sort of a rise to continue, looking at the other countries, especially UK as well as South Africa and France, and of course US. So we might actually see an exponential rise in the cases if Omicron is the major contributing factor, which is what we are all fearing about. So right now, I think keep an eye on the ball. Keep our self-restraint to the highest level, and double masking and social distancing and air ventilation should be the norm for every citizen of the country. I am absolutely certain about that without that, we will not be able to curb down these numbers. Otherwise, these numbers will keep on rising exponentially.
Dr. Joshi, you know, while not a lot is known really about the Omicron variant, but is it really a variant of concern? Because, you know, we have only UK as an example right now with us, wherein the probability seems to be indicating that it's more transmissible. The virality is pretty high, but the severity is not. You know, people have at best mild symptoms, maybe a few hospitalization cases here and there, but much milder than the Delta variant.
It is clearly a variant of concern. I don't think there is any doubt about it. WHO declared it almost a month back. Number two, we don't have data only from UK. We have data from South Africa, UK, Denmark, Norway, where there is community spread. We have data from rest of Europe, including France and Germany, as well as United States, and more than 110 countries now have Omicron. Omicron, as you said, is rapidly transmissible, no question asked. It may cause less severe disease, less hospitalizations, less death, but you will need to wait for another 2 months to know the true picture. What is second feature of Omicron, which is worrisome, is even if you have had COVID, even if you have taken 2 shots of vaccine or an extra booster shot, you can still get the disease. But the disease is likely to be mild and the severity is likely to be less. The unknown about Omicron is that whether it will cause long COVID, whether it will cause severe COVID in the long run, whether it will have any other deleterious effect, we don't know. Our hope is that Omicron may replace Delta completely. Delta is the more sinister and the serious variant. And if that happens, then COVID probably might become more manageable in the future in the Omicron wave, and it may become endemic. So this is the hope we have. But the only challenge is that UK or US has currently been overwhelmed by the sheer number of cases. And there it is in the unvaccinated or the partially vaccinated group. And there is simultaneous Delta as well as simultaneous Omicron. And it is Delta which is killing. So obviously when 2 strains of the virus are in circulation, which is likely also in a city like Mumbai, where the doubling has happened in less than 4 days. In 4 days, we saw doubling of cases, which is very exponential. So indirect evidence and mild disease and no overwhelming of hospitals or hospitalized beds. Indirectly, it suggests that there is definitely a cluster outbreak of Omicron. There is no need to panic. There is no need to, get jittery about it. But at the same time, probably it heralds, at least in Mumbai city, a possible third wave, which is coming up. And next 2 to 4 weeks, we will see much larger numbers. But the rapidity of numbers, we had just 150, 200 cases a week back, and now we are 1,000 plus. It's clearly a cause of concern. And all it needs is simple things to be done. We need a lot of citizen cooperation, responsible behavior, masking, and ventilation and vaccination to be done on a priority. But clearly, though it's one of the most rapidly transmissible strains, it also evades natural immunity or vaccine immunity. That is the second concern of Omicron. But the reassuring part is it is a mild disease, hospitalization strain on the healthcare infrastructure, as well as deaths are less. And let us hope the global trend continues in India.
Right, sir. Really appreciate your point there. Dr. Pandit, good morning. Good to connect with you. I'm talking to you after a while. Dr. Pandit, can we decisively say this, that this virus is going to be less in terms of severity? Are these assumptions, or this is based on hope, based on science and less hope?
So if the new variant Omicron is what we are talking about, what we have now is a data of around 5 weeks from at least 4 or 5 countries which have known to collect data in a very methodical way and present it out. So looking at that data, we could say that yes, most of these patients have got a mild disease, but not all. Some of them would go into the category of moderate to severe disease, and there are around 10 or 12 deaths reported from United Kingdom, which have been confirmed to be Omicron as well. But if you look at the subset of population which is going in for a severe disease, that subset is the one which is either immunocompromised or who have had poor vaccine penetration in them. So the people who are vaccinated, people who have had COVID before and who are vaccinated definitely have a much stronger immune response. And in them, the disease is definitely mild. So it's no doubt, and it's very clear that vaccine gives you very good immunity against severe disease and mortality. And that message should be very loud and clear for people to understand. Because as Professor Joshi said, there is no doubt that this virus spreads much more faster. You can deliberate and talk about 2 times or 3 times or 5 times, but it does double up in a matter of 2 to 3 days. And this is what we've seen in Mumbai right now. And that's the biggest fear that we have, that are we already seeing Omicron as a predominant strain? I think anything more than that right now with just 4 or 5 weeks of data is a little bit too ambitious to comment on, but it hopes and we do hope that it sort of behaves in a similar way as it has behaved in the European countries and the Northern American continent.
Dr. Joshi, final comments. If I look at the total vaccine population or vaccinated population of India, the number is very impressive. Over 100 crore doses have been administered. So can I safely say that we should not compare UK and US data, because the number of vaccinated people are less, and India the number of vaccinated people are more. So even if the virus spreads and if early evidence is that it is impacting vaccinated people less, we are in a safe zone?
I would not say that, because India clearly has better vaccination coverage. At least 90% of Indians, more than 140 crores, have got 1 dose. 60+% have got 2 doses. In countries like US and UK, 60% have got 2 doses. UK probably have got 80% with 2 doses, and even they have started an additional dose or a booster dose program in place. Having said that, a lot of India has also got natural exposure. But I think it is the immune response of different geographies, different ethnicities, which is different. So like South Africa, India may be similar, and we may have a more robust immune response and may have a milder disease. But there's a lot of animal data also now and laboratory data to support this evidence. See, we have moved within 5 to 6 weeks from informed speculation to hard evidence. And now we know a data from Hong Kong lab or a Japanese lab or a US lab, which has shown that the lungs are not as affected as the airways are. So the upper airways get more disease. You get a scratchy throat. You get, severe, body ache. Those are the symptoms. Lack of smell and taste is not there. So that is the challenge. The biggest challenge is that most of the Omicron will be managed at home, and that is where it will transmit to multiple people. So the home care will have to be on high vigil. Number two is that the Delta has to be deciphered out from Omicron. And therefore, the genomic testing will have to be upped, including private sector, at least for the S gene deletion and so on and so forth. So those are the public health challenges we'll face in the next 1 month. And third is that there is winter around the corner in parts of North India, where there is a lot of suspended particulate matter, a lot of lower temperatures, a lot of smog and fog, which actually makes an airborne droplet virus, which is more transmissible, more quickly to spread. So we definitely have to be vigilant and cautious without any panic. And I think that is the need of the hour. But you are absolutely right that a larger cohort of vaccination will definitely confer an indirect degree of immune boosting effect.
Doctors, appreciate your time. Stay safe. It's been a hard year for all of us, and let's hope that the virus spread is limited and restricted. And next time we are talking to you, we're looking at better things and perhaps some containment on the virus spread. Appreciate your time and have a wonderful 2022 ahead.
Thank you very much.
Thank you.